Good morning, doctor, and good morning, everyone. We are from the SGDB3. We would like to give a presentations about our student project we title Embolic Stroke. My name is Duku Prayitno with student number 076, and I would like to start with introductions. Embolic strokes occur when there's a blockage in cerebral arteries caused by clots from the distal part of the body. It can be aortic, cardiac, or arterial. This blockage causes ischemia by mechanism perfusion cessation of brain tissue. Careful diagnostic approach such as anamnesis, physical examinations, or additional examinations such as laboratory or radiology would be advantageous for the patients due to the improvement of the patient's prognosis. Risk factor of embolic strokes were gender, history of hypertension, cardiac disease, and the total blood cholesterol level. Comprehension of treatment for patients is also needed, even though the treatment for all acute strokes is relatively the same, to minimize the possible complications ahead, such as hemiplegia. And then, in history taking and examinations, clinicians should be aware about family or relative conditions, since patients' post-treatment conditions are closely related with family support. Also, family and genetic risk factor can be examined to detect families with the high risk of getting similar conditions with patients. Because all of those reasons, the author would like to construct a further discussions about embolic stroke, especially with the hypertension and hemiplegia, through this student project.
My name is Gilbert Nugradena with student number 193. Definition: embolic strokes is formed by two words. Embolic is derived from the word embolism, which means blockage of an artery, usually caused by an air bubble or a blood clot, and the word stroke, a condition in which blood flow to the brain is reduced and causing cell death. An embolic stroke is a condition that occurs when a blood clot that forms anywhere in the body breaks apart and travels through the bloodstream to the brain. A blood clot then lodges in the artery in the brain, blocking blood flow and causing a stroke.
Hello, my name is Nicole Puntario Pramana Putri with student number 65. So the etiology of embolic strokes, it happens because there are clots that migrate from the source and block more distal cerebral arteries. It could be from aortic, arterial, cardiac, venous origin, in the lower limbs or pelvis, and even unknown source. The clots cause cessation of brain tissue perfusion and ischemia, and different mechanisms can cause emboli. Generally, the most severe ischemic stroke subtype is cardioembolic source, which the majority of the thrombi are made within the chamber. And for some people, the thrombi are from pathological cardiac valve. The emboli, which arise from blood stasis in the left cardiac chamber, are usually large and might cause right vessel occlusion. The most prevalent cause of cardioembolic strokes is atrial fibrillation. The risk of having it is increased 17-fold in patients with valvular atrial fibrillation, and most of the cases are believed to occur secondary to hypertensive or ischemic heart disease. Other common cause or high-risk conditions that cause embolic stroke are recent myocardial infarction, dilated myocardiopathy, mechanical prosthetic valve, mitral rheumatic stenosis respectively, and bacterial, non-bacterial endocarditis. Thank you.
My name is Anastasia Vanetrix Kusianto, student number 128. I will explain about the anamnesis of embolic stroke. Anamnesis or history taking can be done using basic 7 rules and fundamental 4. Anamnesis could be done to the patient, patient's family, and any eyewitnesses. Especially for stroke, there are 6 main questions. The first one is about the onset. By knowing the onset, the treatment will be more effective. The second one is neurological deficit. We can ask some questions. For example, are there any neurological symptoms? Are the neurological symptoms stable, fluctuating, worsening, or improving? How long do the symptoms happen? The third one is about past medical history and risk factors. For example, are there any bleeding history? Does the patient have history of hypertension, dyslipidemia, diabetes, or alcohol abuse? Is there any recent or ongoing therapy? The fourth one and the fifth one is functional status and occupation. Also, if patients arrive with medical emergency service, we can ask about their vital signs, cardiac rhythm, and blood glucose. The last one is about the nearest hospital. This is a very important question in case for handling the patient in case of an emergency. Thank you.
Hello, my name is Wulan. My number is 010, and here I would like to guide you through the complete physical examinations that would be suggested of initial diagnosis clue in order to diagnose a patient relating to embolic stroke. Now, closely related to hypertension and hemiparesis, there are two physical assessments that should be taken into considerations. Those are GPA and systemic examinations, and number two is neurological examinations. So the diagnosis of GPA itself is based on clinical suspicions, finding a thorough history and physical examinations, and supporting laboratory data, and this would include general appearance and vital signs, other functions of the organ system, such as does the patient comes with abnormal bruising, is there any visual defect, is there any deafness, is there any carotid bruit, does the patient comes with murmur or arrhythmia, is there any tenderness or mass that we can find in the abdomen area. Does the patient also experience urinary incontinence, and also other physical neurological findings such as muscle weakness, vertigo, ataxia, and other cranial nerve abnormalities. While the physical examination finding in X vector may vary according to blood vessels involved and site of infarctions, it can also be done by using standardized scoring system to assess the patient's prognosis and treatment strategy. The two types of scoring system widely used are Glasgow Coma Scale and IHS as scoring system. So Glasgow Coma Score helps determine the severity of infections, extent of damage, and prognosis in unconscious and semi-conscious patients. And the score is determined by adding score in each category with maximum score of 15 and minimum score of 3.
Hello, my name is Jonathan Edmund with student number 137. Right now I'm gonna explain about additional examination for embolic stroke. Some examination that should be considered to evaluate patients with embolic strokes expected are X-ray and CT scan. The most common examination that can be done to evaluate any type of stroke is CT scan. Series of X-ray could also be done to show blood vessels in our necks and brain to gather information in greater detail. CT scan should be done to rule out intracranial bleeding. MRI test can also be done to assess any brain tissue that has been damaged due to stroke. Using radio waves, this could be an additional examination. Fatty deposit and also blood flow can also be examined using carotid ultrasound.
My name is Putri Pranyani with the last number 222, so the next examination is cerebral angiogram. It's a procedure to inserting a catheter through a small incision into our carotid or vertebral arteries to view our arteries on the neck and also the brain. Next is echocardiogram to determine the location of any blood clot that may have been traveled from our heart to our brain. Also, there's other examination to be considered, including the velocity of our blood clotting, and then there's a blood chemical balance, and the last is blood sugar level. Thank you.
Thank you for the opportunity. My name is Eduardo Kinjiro with the last 3 digits of my serial number is 119. Now I'm going to explain about the differential diagnosis. When a patient has focal neurologic symptoms leading to an embolic stroke, intracranial hemorrhage or ICH should be considered, and this can be ruled out using a CT scan of the brain. ICH represents intraparenchymal hemorrhage secondary to hypertension or amyloid angiopathy, other than subarachnoid and subdural hematomas. In addition, TOTS paralysis should be considered if the patient has seizures with unilateral post-ictal weakness. However, this disease is usually short in duration and sometimes has a prolonged post-ictal state. Hypoglycemia is another important differential diagnosis to consider if the patient has focal neurologic deficits. Therefore, before giving TPA-IV, it is necessary to check the patient's blood sugar level first. Other differential diagnoses such as migraine with aura can also cause neurological symptoms, including visual and sensory symptoms. Of course, there are other differential diagnoses, but less often to be considered, such as multiple sclerosis, brain tumors, and in patients with previous strokes who may reappearance of all symptoms. That's it for me. Next one is going to be explained by my colleague. Thank you.
My name is Kama Arieta Grasidip, student number 234. I want to explain about the risk factor of embolic stroke. So the risk factor of embolic stroke were about gender, history of hypertension, cardiac disease, and total blood cholesterol level. So based on the study, it shows that males are more susceptible to get stroke than females. The risk of stroke is about 2 until 4 times higher in people with hypertension. And there's also a significant relationship between obesity, profile blood lipids, and blood sugar levels with the stroke. So obesity and blood sugar is a predictor factor that can be used to predict the stroke, and the risk factor that influences the non-hemorrhagic is total blood cholesterol levels that above 200. If all of these risk factor variables interact, the risk of a person experiencing a non-hemorrhagic stroke is about 81.6%.
The next is family interaction. Brain stroke, especially the type caused by embolism, is the most common cause of permanent disability worldwide and has a serious negative impact on the life and of patient and their family. In this case, family caregiver will usually provide the majority of care once stroke survivors are sent home. In spite of this, interaction in family patients are typically not treated as essential aspect in the course of stroke therapy. This can caused by several factors, including first, family have internal difficulty and a number of impediments. Second, family may not consider themselves to be the essential to the care of patient condition. And lastly, family are forced to deal with negative effect as the result of sudden and unexpected emergence of this ailment, including shock, anxiety, and depression. In the case of patient with embolic stroke, will unable to perform basic daily activity, which cause stress both to the patient due to feeling of helplessness and to the family due to the feeling for sad to the patient. Additionally, embolic stroke patients with hypertension and hemiplegia are also unable to support hypertension treatment alone, which resulting in patient dependence on family member. Therefore, this can cause further stress and social pressure.
Okay, thank you for the test that given to me. My name is Rafael Kurnia Pratama Tokan with the last 3 digit number of my student registration number 055. I'll explain about the impact of embolic stroke to the family. There are some impact of embolic stroke to the family. Based on a study from Capinala 2020, there were 69.6% of the patient were unemployed. And after the unemployment of the patient, the outcome per month also increased due to the medicine of the stroke. And besides the impact in socioeconomics, there were also impact in mental health of the caregivers. Based on study from Halle 2015, the caregivers of the patient more likely to facing depression in the first 9 months. And also there were impacts in health quality of the caregivers, where in a lower education and income of caregivers, they were more likely to develop lung disease, sensory limitation, stroke, and more health problems. Okay, that's all from me. Thank you.
Greetings, my name is Alden Jaliakema with student number 097. Next is about the family medicine approach. First of all, family medicine focuses on providing a holistic, comprehensive primary, personal, and continuing healthcare of an individual in relation to his family, community, and environment. Here, in the case of stroke, the general goals are to provide a patient-centered and family-focused care, preventing recurrent brain injury and complications, as well as optimizing bodily function and quality of life. The first post-stroke visit should also be already done in 1 to 3 weeks after acute care discharge in order to avoid recurrent stroke risk. In the process, aside from managing risk factors like high blood pressure, diabetes, and dyslipidemia, screening should also be done for functional and psychological complications, such as fall risk, depression, and cognitive impairment. Because the patient-centered care focuses on relieving pain, fear, and anxiety, as well as letting the patient express their needs, fears, questions, values, and autonomous preferences. Therefore, the patients, caregivers, and family members must be involved in this process. They can help identify and provide the patient's unmet needs, whether it is functional, psychological, or social, which would improve risk factor controls and outcomes. First, the family should be educated on helping to provide the daily personal care of the patient, such as dressing, bathing, toileting, and supporting mobility when they are walking and when they are getting on and off the bed. Then they need to know when to give the patient his medicine and how to change their wound dressing. Furthermore, they should also be accompanying the patient all the time. For instance, by doing household chores like cooking, house cleaning, and grocery shopping, as well as providing financial support. To minimize the risk of recurrent stroke, life modifications, including balanced diet and exercise, are highly recommended. That's why it is also recommended for the patient's family to avoid frying food for the patient and instead provide food by other cooking methods, such as grilling, boiling, and steaming, where the patient should consume fiber-rich meals such as nuts, fruits, vegetables, and whole grains, as they have a direct hypocholesterolemic effect on the body.
Thank you for the time. My name is Joshua Mantoro with the last three-digit number 035. An embolic stroke is defined as a condition in which blood clot formed within the body breaks and travels through the circulatory system that ultimately reaches the brain. Similar to other diseases, embolic stroke can also be diagnosed through the anamnesis process. It is important to note the onset, chronology, past history of disease, and lifestyle in order to have a thorough understanding of the patient's condition. Several mechanisms in diagnosing patients with embolic stroke are by analyzing their condition, especially if they have link to hypertension and hemiparesis. As a method of diagnosing embolic stroke, clinicians can do physical examination or prescribe other additional examinations such as X-ray, CT, and ultrasound. After the diagnosis, most embolic stroke patients will be treated at home, hence family caregivers are the subjects that will provide the majority of care for stroke survivors. Based on this condition, it is important for the family caregivers to be included in treatment planning, adapt to the patient's living limitations, and also took care of the patient's etiological disease. It is important to note that it is important to keep focusing at the patient through a patient-centered care philosophy. Thank you.